Continue with our KGUN 9 initiative, the Rebound Arizona, a new community-wide effort to help Southern Arizona rise to the impacts of COVID-19. Now tonight, we look at how organizations are handling the mental health of workers on the front lines of this COVID-19 fight. 9 on your side, Chandrea Thomas found out what CODAC is doing on a daily basis.
Healthcare workers are dealing with higher levels of stress caused by the coronavirus pandemic. So I went to local experts to find out how some companies are helping their workers deal with the situation.
Our staff have a very positive professional attitude. They're willing to jump in. They're also willing to voice their boundaries as it relates to this.
Dr. Amy Munoz with CODAC says today's climate is putting pressure on employees, but workers are doing the best they can. They handle everything from primary care to methadone and mental health treatments to case management.
It's a 180 for us. We have been slowly inching into being able to provide more telemedicine and telepsych services, but this has forced us to jump into that role.
Workers are also worried about the health of their loved ones, and having peer support is key.
As far as the darker side goes, we see some guilt about the possibility of being on the front lines and bringing this disease home to their families. A lot of our staff have younger children and loved ones and folks that fall into that high-risk category.
Dr. Munoz says they're altering how they handle patients, and that changes the dynamic of regular treatment, especially when it comes to home visits.
The silver lining in this is that we've seen through teledoc, through telepsych, through telemedicine, we've seen a lower no-show rate just because we're able to call people and utilize these like Skype, Zoom platforms in order to reach people.
While CODAC has protocols in place to keep workers on track, they also say it's important to get accurate information about what's happening with COVID-19 guidelines and to have patience and understanding for those working on the front lines.
Our staff are doing regular check-ins with each other, so they're reaching out to one another. We're on several different threads. We utilize email constantly. We're physically distanced, but not necessarily socially distant. Relaxation, checking in with your colleagues, your family, your friends, self-monitoring, pacing, timeouts. We encourage our staff to do that.
Chandrea Thomas, KGUN 9 on your side.
If you have a story to share with us, we would love to hear from you. You can send us your story at kgun9.com/rebound, or you can email rebound@kgun9.com. Over the past week,